Hola, yo soy Catita de este canal Yo Soy Fermentista y del blog yo soy Pachamamista.com. Ahora la entrevista que vas a ver es con el dentista Dr. Mark Burhenne en California. Él lleva más de 30 años siendo dentista, es el tipo de dentista que todos quisiéramos tener. Es súper bueno y esta entrevista es muy interesante. Hablamos de temas sobre como la salud del microbioma de la boca. Hablamos también muchísimo sobre el sueño, porque hay señales que aparecen en la boca que te dicen a ti y a tu dentista si estás durmiendo bien o no. Y un buen sueño es fundamental para tener una vida saludable y para tener energía y salud en las horas despiertas, digamos. Así que ojalá que esta entrevista te sirva muchísimo. La página de web del Dr. Mark Burhenne es askthedentist.com. Está todo en inglés y puedes usar Google Translate para traducir a una información de su página al español. Pero también te quería comentar si podemos generar interés en español sobre el trabajo de Mark Burhenne. Puede ser que poco a poco haya más oportunidades de traducir su información a español. Así que por favor, si te gusta esta entrevista, compártela con tus seres queridos, con tus amigos, con tu familia y nos vemos en los comentarios. Muchas gracias y disfruta la entrevista. Bye.
Hello and welcome, fermentistas. Today we are with Dr. Mark Burhenne, Dr. B, who's out in California, and we are going to be talking about some really important topics. We are going to be talking about the health of the mouth and how the mouth is a reflection of the health of the rest of your body. And we're also going to be talking about the mouth and how there are all these signs in the mouth that manifest and that show us if you are sleeping properly or not. And your destiny is determined by how well you sleep. And I think a lot of people's minds will be blown that that a dentist can actually see if you're sleeping well or not. I don't think most people realize that that dentists kind of get an inside look, almost a gateway into your soul or to your brain, to the rest of your body, because they look in your mouth. So we've got a lot to talk about. Dr. B, I'm very grateful for your time. It's such an honor to have you here, to talk with you. So maybe we start by talking about the mouth and how is it possible that the mouth can show us what's happening with our sleep and also what's happening with the health of the rest of our body.
Yeah, I mean, the mouth is amazing in so many ways. I remember being in dental school 34 years ago, and it was only 10 years ago that I realized that it was so connected to, for example, what you just said, sleep. And it was that aha moment, of course. I mean, a few of them. It's never that one, but because I had sleep apnea, but it didn't surprise me because it does make so much sense. The only part that really upset me is that I didn't have this information sooner for my 3 daughters and also for my development. So, and we've known about it. All the little bits and pieces are out there. Weston Price, facial development in dental school and the curriculum, the nutritional aspect of it, it's all there, but it's never been connected. So it's just now that we're connecting this. So yeah, on our website, we talk about how what happens in the mouth happens in the body. And it can be the opposite. I mean, there's the gut-brain axis in terms of the biome, the gut microbiome. There are connections between the oral microbiome and the gut microbiome. The oral microbiome is one of the, I think it's the second most diverse biome in the body. There are several of them, of course, but it's all connected. And it's, to me, it's just amazing. Every day I read something where, aha, okay, this is connected to this and this and this and this. It's not simple. And my dental training and some of my medical training has been very simplistic in many ways in terms of looking at it in isolation, like this system is this and it causes this. And then this is how you treat it. Typically we're treating symptoms and signs. And, but, you know, if you go back to root cause issues and what happened when prenatally, what happened, how did we develop, and then what effect does that have on everything and how it's all connected, being the interconnectedness of our biome and body and immune system and personality and then throw in the environment. It is overwhelming, phenomenally overwhelming. But I'm glad that we're finally seeing it for what it is. And we have a lot to learn, certainly.
And I totally agree. We have so much to learn. And I'm so grateful for dentists like you. I think that it can be challenging for people to find a dentist that recognizes that just like any other organ system, we can't simply isolate the mouth and say the problems are here and they stay here. You know, finding a dentist that can see the bigger picture and see just how connected the mouth is with the rest of the body, that is a gift. And I hope that more and more dentists become educated in what we're talking about in holistic medicine, because dentists, like we're going to talk about, can see things that are happening in the body maybe before they become really serious problems in the body. For example, dentists can see if you're breathing well or not at night, and the way that you breathe at night, it dictates how well you'll sleep. So maybe we'll talk about that, like well, let's talk about breathing and how it relates to sleep.
Yeah, so your first point, you're right. Oral health has been isolated. That happened in the late 1800s in the US, and dentistry and medicine kind of diverged, and physicians refer to the mouth as the little black box. So, I mean, that's not a great thing. And hopefully that collaboration is going to improve. I see signs of it already. Yeah, so just from let me just use one example. Mm-hmm. And again, I learned this after decades of practicing. I have a lot of patients that don't like coming to see me. Mm-hmm. And I'll tell you right off the bat, 90% of it is because they cannot breathe through their nose. Mm-hmm. People are like, okay, well, who cares whether you breathe through your mouth or nose? If a dentist has water in the back, squirting water in the back of your throat, has his hands and fingers in there and has a rubber dam, and if you block that airway and you can't breathe through your nose, your primal instinct of not being able to breathe, that fight or flight response, is going to become very active. Not necessarily because of dental work and maybe, you know, thinking there's maybe going to be some pain coming. It's because you can't breathe, and breathing is primal compared to like starving or not having enough water or even not having enough sleep. Within a minute or two, no air, you're dead, you're gone. And so that primal drive to breathe is very strong, but with it comes anxiety and if you can't breathe. So dentists can see this at a very practical level. We can also see it based on facial development, different facial types. We can see it based on the color of the gums. We can measure distances between the upper second molars. A wide jaw that grows forward and grows widthwise is a great thing. But a lot of us are developing with very narrow jaws. Maybe we have some downward growth, but we don't have the forward growth. The thing is very simple. The thing I always tell my patients is that we have three boxes, three very important boxes. We have the mouth box, the nose box, and we have the airway box, the throat. And if the mouth box does not develop correctly, and we can talk about how that happens, and we're seeing a lot of it, it's an epidemic. If the mouth box doesn't develop correctly by age 10, then the nose box and the airway box are compromised.
Mhm.
And that sounds many harms. I mean, we do all our breathing through the nose, we do our swallowing, and we do our breathing through the airway, of course. It affects our sleep. It can cause sleep apnea, but it can do other things. It can cause TMJ due to a lot of grinding. It can cause poor nutrition. It can cause self-image issues. It can cause systemic things like getting rashes and being sick, and because the level of acid or pH in your blood is high because you're not breathing properly. Breathing properly is the #1 skill we all need to learn how to do. We need to breathe properly. And of course, when we're asleep, there's no one there to watch us, and we're not awake. We're unconscious. We cannot breathe properly or monitor that. So that's where mouth taping comes in. We can talk about that as well. But yeah, breathing is important. Dentists are great at this. Again, everything I've learned after dental school, I look back on my dental curriculum, the basics were there, the information was there, but it's nice now to key it all in and bring it together into something that can help us thrive and live a better life and live a longer life, of course.
So, okay, humans are designed to breathe through their nose. I mentioned that in like a post a few weeks ago, and somebody said, no, we've got 2 holes, so God is generous. But the mouth is really kind of a way back up. It's a plan Z. We are designed to breathe through our nose. So maybe we should talk about, like, why is it so important to breathe through your nose? We'll talk about that first, and then we'll talk about the problems of mouth breathing from birth up until adulthood. First, why breathe through your nose? What happens when you breathe through your nose?
Right, I get that a lot. You know, why not breathe through your mouth? Because it's bigger. You can get more air into your lungs. Well, it's how. So we are always balancing CO2 and O2. We cannot live on O2 alone. We need CO2. And when you breathe through your nose, you are able to balance the CO2 and the O2, and this dissolves in your blood. In other words, the lung is kind of this transitional organ that gets the right amount of oxygen and pulls out the CO2 out of the blood. And to do that properly, you have to breathe through your nose. You cannot overbreathe CO2. You can't hyperventilate. That's why we put the paper bag over people that are hyperventilating. I mean, breathing through your mouth creates a lot of problems, brings in way too much oxygen. And when we breathe out through the mouth, for example, which is just as important as breathing in through the mouth, we essentially get this acidosis of the blood. All that means is that the pH of the blood changes. And the pH of the blood has to be very neutral. It has to be a 6.8 to 7.1, 7.2. And you can bring that way down by just breathing through your mouth. And again, people think, well, I'm talking, which means I'm talking now, I'm breathing through my mouth. That's true, but think about it when you're at rest. Think about it when you're driving. Think about it when you're sleeping, hopefully for 7 or 8 or 9 hours, and your mouth is open all night long. Your blood level, your blood pH drops. It becomes more acidic. That's like adding carbonic acid to water to give it the bubblies and, you know, carbonation. You're carbonating your blood. And what does that do? It causes congestion. Congestion causes you, prevents you from breathing through your nose, for example. It increases that histaminic response. It can cause a host of other issues, immune response or lack of it. It can even, then on top of that, it changes your breathing rate. Your breathing rate goes up because your body's trying to compensate. But if it's not able to expel air through the nose or inhale through the nose, then your CO2 levels stay high. The base of the brain, which is a very basic functioning part of the brain, we don't have control over it. It's the kind of the autonomic kind of the automatically working part of our brain. There's no direct control over it. We can control our breathing, but that's a different area. That is looking for CO2 in the blood. And when it sees a lot of CO2 in the blood, all it can do to prevent that from getting worse is by increasing your breathing rate, which leads to inhalation. Eventually, become, start breathing too quickly, right? So we look at that during deep sleep. We want that breathing rate to drop. And so taping your mouth shut, for example, or being able to breathe through your nose will bring down your respiratory rate. I monitor that every single night. I have a device that checks my respiratory rate. If my respiratory rate goes up at night, I know something's wrong. Maybe it's my CO2 in the blood. So it's a very complicated system, but it's not perfect. So if your mouth is open all the time, especially at night, your body is able to compensate, but it's not a good compensation. It comes with a cost.
Mm-hmm. So this is interesting because a lot of people talk about shifts in the pH of your blood, and they speak about like acidic foods and alkaline foods, but the actual main driver of the change of pH in your blood is not by what you eat, it's about how you breathe. Is that correct?
That is correct. So I get a little tired of that argument about if you eat like a citric acid type of food, like an orange, is that good for your blood pH and all that? That has something to do with it, but really the main driver is how you breathe. So if you're worried about the pH of your blood, start working on your breathing. That is the biggest predictor of what your pH will be of your blood. Absolutely.
That's amazing, because that dispels so many myths about people who are concerned with really nutrient-dense foods like grass-fed meat, for example. These are foods that nourish our body and that are really necessary for optimal function. Right. But people have this idea that they're acidic and they're going to be bad for our blood pH. So that's important. We breathe through our nose to maintain proper pH of the blood, which is slightly alkaline. We also breathe through the nose because we produce nitric oxide. Can you talk about that?
Right. So nitric oxide is an incredible compound, and we create it through the bacteria in our gut. But one of the biggest contributors to this creation of this compound, which I'll explain why it's so great, is through nose breathing. There are bacteria. If you have a good nasal biome, another biome exists there. If you have a good nasal biome, 25% of your nitric oxide production occurs breathing through your nose. It occurs in your mouth as well, and also in the gut, as I explained. But this compound actually is bactericidal. It's part of the immune system. But it also helps with blood pressure. In other words, it calms you down. It will actually vasodilate blood vessels, and that way you get more blood to your peripheral tissues. It lowers your blood pressure. It makes you a little bit more calm and serene. And so you need this compound, and 1/4 of it is made by nose breathing. So if you're not nose breathing and you're mouth breathing, you're missing out on all that. So nitric oxide is a great compound, but it's only around for like 0.25 of a millisecond. You need to be breathing through your nose to get that. All the gurus have been right all along. All the yogis and Ayurvedic, it's not just Ayurvedic, it's meditation and anything that can where you can focus on your breathing and have control over the parts that you can control. That's breathing rate, but how you breathe, whether you exhale or inhale through your nose, your mouth, all of those things we've known for a long time have an effect. It's just now that we're beginning to understand how it's related. And also the volume of air that you bring in through your nose is less, and it comes past the airway, which is likely to collapse if you have sleep apnea. And so if you have a narrow airway and you breathe through your mouth, the volume of air comes in at a much greater volume, for the given amount of time. And that, like a balloon, will pull the airway shut. That's why breathing through your nose is great if you're kind of borderline when it comes to snoring and having an airway that collapses. So also the nasal biome, that is very important. That's where our sense of smell is. Being able to breathe through your nose helps that. Also allergies. If you breathe through your nose, you're less likely to get congestion. It decreases that, it lowers that histaminic response, the threshold for it, by being able to keep this area moist and keep the bacteria, happy, and keep all those colonies of bacteria in their optimal ratios. But if you stop using your nose and you're breathing through your mouth, you're going to lose the ability of making nitric oxide, of being able to smell things and enjoy certain foods. Maybe it could even reach out to the point where you are smelling things that are good for you nutritionally. I mean, our bodies are looking for things and craving things that are typically good for us. That doesn't fit with the argument of processed sugar. It's kind of a mistake that our body, wants that. But that came afterwards with industrialized agricultural and all that. But our noses are important, and people that can't smell, I think, are handicapped. It's an important feature of our senses.
So when we breathe through the nose, we actually get less volume of air, but we're better oxygenated. Is that right?
So yeah, I misspoke a little bit. So the volume may be the same, but it comes through at a lower rate.
Okay, so it's meaning it's like a slower, more constant, more controlled.
Exactly.
Okay.
And that's the Bernoulli effect. If you pull air, a lot of air all at once through a tube, you're going to close down that tube. That tube will suck down. But if you pull the air through slowly, because remember, the air, it has to go through all these baffles. It's a maze back there if you have the right nasal volume, nasal sinus volume, and all that. And if it's open and clear. But being able to breathe through the nose like that slows everything down. Also, it helps on the exhale. In mountaineering, a lot of mountaineers, when they're climbing Everest, will actually practice proper breathing methods where they're doing what's called the pressure breath rest step, and they're exhaling, they're trying to get more oxygenation. They're trying to get more O2 to their muscles. By doing that, they're properly breathing so their CO2 amount is correct. They're doing that through the nose.
Okay, so we're designed to breathe through our nose. We understand that optimal human health is not really possible unless you breathe through your nose the way that nature or God designed us. So many people now are mouth breathers.
Mm-hmm.
They're not breathing by design. Mouth breathing has repercussions, huge repercussions for health. Some adults will say, it's because I have allergies, my nose gets stuffy. But before we talk about that, I kind of want to bring it back to why do we have an epidemic of mouth breathers? And I think it has something to do with preconception nutrition, because modern humans are much more narrow than our ancestors were. We have more narrow faces, like mine, narrow nostrils, narrow airways. So I kind of want to take it into this bigger picture, or maybe before picture, as to why are we mouth breathers now more than we were before? Why aren't we breathing by design?
Yeah, so I think it's not just that we're good at now making the differentiation and we're better at diagnosing this. I think it's more than that. I think you're right. It's because we have changed as a species. I mean, in terms of our facial development, and that's probably due to epigenetic factors, prenatal or preconception nutrition. Absolutely, it's our diet. It is lack of sleep. It is fluoride in the water. That's a controversial one, but it's also the glyphosate in our system from the Monsanto product. I mean, all these things have an impact because they impact mineral deposition, building of the bones, of the facial bones. I mean, remember, the face is developed by muscles. It's not just like a blueprint that expresses itself. You have to have the proper swallow reflex. You have to breastfeed properly. You have to be breathing through your nose. And as a infant up until you're 10 years old, to get this face that we need, those 3 boxes that are referred to, so that all 3 boxes are the right size and patent and open and working properly. So yeah, there is an epidemic where, I mean, look at it. Look at our definition of beauty. That has changed. They just, I forget her name, very beautiful woman, but she was voted as the most beautiful woman in the world by a group of plastic surgeons. And this was a few weeks ago. Her first name is Bella, I think. But anyway, I was shocked from a dental perspective. I mean, very thin, tapering chin, retrognathic, class 2, chin pushed back, grinding, signs of bruxism. I mean, this, and lips always parted in the photos. I mean, this is not the ideal. I mean, we've even changed what we think is ideal in terms of aesthetics. And so it's really messed up. I mean, and it does start, you're right, it does start before conception, but a lot of it has to do with what happens after you're born. And I refer to those, of course, breastfeeding and epigenetic factors, being allergic to something. And then if you're allergic, your nose is blocked, and then your adenoids and tonsils are oversized, and you have breathing issues, and then your sleep is affected, and it's all connected. So it's really very messed up. I mean, we have all the wrong perceptions of what is going on here and what's right.
Well, I think that's a really interesting point, because most people look in the mirror and they say, hey, I look the way I look because, yeah, that's my destiny. It's my destiny to have the face that I have and to look the way I look.
Right.
But what we're saying is that there's actually, the diet of your parents before you were conceived, the diet of your mom while you were inside of her, the way you were born, if you were born vaginally or by C-section.
Yes.
How long that you breastfed, the quality of the milk that you fed, maybe your exposure to allergens as a young child. All of these things shape the way that your face develops. Right. And the way that your face develops literally dictates your destiny, especially in terms of your personality. Kind of like this modern, hyped up, nervous, anxious person, like it's usually a very thin person like me. I mean, it's so interesting to think if I had a different childhood, for example, a different birthing story, a different breastfeeding story, if I had developed to be a little bit wider, like nature designed, would I have a different personality? I mean, maybe things aren't written in the stars as we think that they are. That's right. So fascinating.
Yeah. From the eyes down, this is all very malleable, right? Mm-hmm. Actually, from the eyes, a little higher. That nose is important.
Oh, yeah.
From that down, we have a big responsibility of getting that right. And that's prenatal to age 10. And this can be affected by many other things, brain development and all that, of course, but the facial structure of the head is it, other than, of course, as you mentioned, vaginal as opposed to cesarean, that does shape the head a little bit. But I mean, there's so many connections to what you just said. For example, if you're born cesarean, you miss out on a lot of your mother's microbiome, and your incidence of your predilection to getting gum disease is heightened. I mean, is increased. I mean, it's like everywhere. You know, if you were to draw a graph of all the things that interconnect, it would have to be three-dimensional, and it would take you a year to really conceptualize. It's that complicated.
That's unbelievable. So mouth breathing, to bring it back to the breathing thing, mouth breathing as a child means that what exactly does that mean for your facial development and for the way that your tongue is placed in your mouth, and how, if your teeth are crowded or not? Like, what are the repercussions of mouth breathing as a child?
Right. So I'll mention all the elements that affect lower facial development.
Okay.
It's tongue tie, which we can talk more about. It is how you swallow, the swallow reflex. It's breathing through your mouth as opposed to breathing through your nose. It's the type of foods you eat. If you're eating a lot of processed foods, you're not getting the resistance that's required. Remember, I told you that there are muscles. It's the facial muscles of mastication and even of expression that shape the face, the lower face. And if those aren't working properly, then your face will be pulled in many different directions. It's a very malleable thing. The bone of a 1-year-old is amazing. I mean, when I extract a tooth from a toddler, I mean, that bone is like clay. That way, it's not a rigid kind of hard thing that has been set in stone. It is moving around. It's dynamic. So people that breathe through their mouth, for example, tend to dry out their adenoids and their tonsils. They tend to get more infections. Of course, they may have lower pH in their blood. They're not sleeping well, so that has effects that comes around. But their mouth, we call it the distance between the upper second molars. It's the width of the upper jaw, the maxilla. And this needs to grow wide, and the face needs to grow downwards and forwards. Okay? That is very, very important. That we learned in dental school, although there have been some modifications to that. We always were told in dental school that the ideal oral posture, and that's a new term, the ideal oral posture, when you're at rest, when you're sitting there reading or watching TV or driving, your lips should be closed, right? Of course, because you're reading through your nose. But in the old days, we used to think that the teeth would be slightly apart, 6 millimeters with an overlap. Now we're thinking the teeth should be touching, and that the tongue should be pushing up and slightly forwards. So it should be filling the complete oral cavity, like a big whale in there, and it's pushing out and up and helping that development. Kids that are breathing through their mouth, of course, if they have to get air past that, the tongue's not going to do that. The tongue's going to get out of the way. So that's not going to happen. You're not going to get that width. And if that box doesn't develop correctly, the nose box is not developing correctly, and then the airway box, the airway box, the most important one, later in life, then you've got sleep apnea. It's going to collapse. If the structure of the bony structure of that box is small, it doesn't develop correctly, it doesn't get the width, then all that tissue in there that's there genetically, it's going to grow as programmed. It won't have enough room to get out of the way, so that when you go to sleep at night and the muscles are paralyzed and relax, then your airway is blocked. And then guess what? You wake up 20, 30, 40, 70 times an hour.
Okay, so another question I have about facial development, especially in children, when I speak to people about the work of Dr. Weston A. Price, and a lot of his work talks about especially preconception nutrition and fat-soluble vitamins, so vitamins A, D, and K2, and their importance for proper facial development. Many people say, oh, that is interesting, but the real reason why, especially in Latin America, people have told me this, the real reason why we have narrow faces is because we're not chewing hard enough food. Is that, like, do you think that that's valid?
Absolutely. I mean, that's very valid. Our food is processed. I have a little granddaughter. I'm always trying to get her to chew on stuff. And of course, we're so worried about her not able to chew it properly and it gets caught in her airway. But I mean, that is absolutely true. Again, it's not just that, it's a combination of so many factors. So baby food, ground up, pureed is the last thing you want to feed your child. You definitely want them. I mean, think of our ancestors. They didn't have blenders or food processors. They were chewing on dried meats when they were, walking long distances. I mean, being held, or if they could walk, they walked. I mean, this is not what we were designed to do. So the actual, again, what I said before, it's the muscles of chewing, swallowing, speech, even the muscles of facial expression. All these muscles are shaping your face. If you don't use them correctly, if you have a tongue tie, for example, and you can't move your tongue in the proper way, or if you can't breastfeed properly, that will lead to a specific type of face. I mean, because that muscle isn't doing, it's not pushing out, the tongue is not filling that palatal space, the palate's supposed to be nicely arched, it can become V-shaped, and that's in both dimensions. That's in the shape of the arch as you look down from the top, but it can also be the shape of the actual arch. All that is shaped by muscles, and part of that is chewing. So I'm not one for gum chewing, but if you can get your 1-year-old to chew on some gum, or better yet, something very crunchy, hard breads maybe, but all our breads are soft and gummy, our food is processed, everything's chopped up into little pieces. That wasn't the norm before we had food processors and blenders and smoothies and all of that. So absolutely, that is true.
That's interesting because, I guess baby food used to be what everybody else was eating. There wasn't kids were breastfed for much longer because mom's milk, especially if mom is well nourished, is a superfood. It's really the only superfood. But we didn't have these like little gerbil, smushy little thing, or these weird juice pack things that kids now.
Or bottles with nipples, orthodontic nipples. I mean, there's a lawsuit currently going on. I think it's 2 moms. I'm not sure about that though, but 2 women that are suing a company that has the word orthodontic in their nipple advertising. And that is very misleading. That silicone nipple, even though it has orthodontic qualities to it, according to the manufacturer, it is not good for facial development. In fact, it's going to mean your child will need braces. So my healthiest patient ever that I've ever met, I like telling this story because to me it was a shock. This was maybe 10, 15 years ago. This was a young man who had never seen a dentist. He was probably 4.5, I would say 4.5, maybe 5 years old, but let's say 4.5. He walked in, he was tall, healthy, he had a beautiful wide arch. His teeth were intensely white, beautiful bite, good oral posture, lips closed, nose breathing, proper facial profile, everything. The other thing that I noticed is that he wasn't nervous. A lot of my young patients are very nervous. Right. Is it because I'm blocking their airway? Is it because they're mouth breathing and they've got low pH blood and acidosis and they're anxious and a host of other things, right? This kid passed with flying colors. And the mom was sitting there in the room, and as soon as the exam was done, I mean, I've had kids jump out the window. Mm-hmm. They're so nervous, little kids. They have jumped out the window past a screen. So this guy was great. He was forthright. He spoke well. I mean, he looked you in the eye. I mean, it's like, that's just not the norm for my younger patients. And when the exam was done, of course, there were no cavities, no tongue tie, no facial developmental issues. There was nothing to say. As soon as he was done, he asked nicely, "Are we done?" I said, "Yes." And I brought the chair up. My dental assistant was there. He jumped out of the chair, went over to his mother, jumped into her lap, pulled up her sweater, and latched on. And I thought, well, that's interesting. The novelty of that, growing up where I did and how I did and in America and being in the Silicon Valley, was like, oh, that's kind of weird. But later I thought about it. That's why he was so healthy. And again, in countries, he was from Eritrea. And in those countries, the minute you're off mom's breast, you are susceptible to malnutrition and poverty. So yes, breastfeeding is key in so many different ways. I think when I was a young father and we were struggling with breastfeeding, and my wife and I, and it was always about the nutrition of the breast milk. And now it's about the motion, the action, the ability to flatten the mother's nipple and pull it in and up, and what the tongue has to do that, to get milk out of mother's breast. That is phenomenal in terms of facial development and being able to sleep well later in life.
That is truly epic, because like you say, most people are focused on mother's milk and the importance of breastfeeding, you know, for longer periods of time because of nutrition. But a lot of moms have less than ideal nutrition, which means maybe less than ideal breast milk. But you're saying even despite that, so we have less than perfect breast milk, it still offers so many benefits because of the way, like mechanically, the way the child has to move and operate in order to successfully take that milk in.
And swallow, and be able to breathe at the same time.
Mm-hmm. Wow.
Yep.
That is so important. It's such an important point, and it's just like, it's just one more reason, and there's many reasons why breastfeeding is so important.
And of course, I'm not able to breastfeed. I'm a man, so maybe this is inappropriate for me to even mention, but what I would like to see, whether it's here in the Silicon Valley or out in the country somewhere, or of course it does happen in some parts of the world still, I would love it if all pregnant women that are breastfeeding got together in a certain area. Maybe it's at work, there's a room designated at the Google buildings, you know, next to daycare, and women that are breastfeeding, in other words, they could breastfeed your child while you made a phone call, and vice versa. Sharing the breast milk is important, but keeping that availability of being able to latch on and have that motion is so important for development of the child, the happiness of the child, the longevity of the child, everything.
I mentioned that to a doctor once because my friend, when she was very young, when she was about 25, had breast cancer, and she wasn't able to breastfeed her second child. So she got breast milk from like a breast milk bank. But I had mentioned to a doctor, like, wow, what if my friend could, you know, just find other lactating women? And the doctor thought that was savage.
Yes. I mean, our granddaughter, we had some breastfeeding issues in the beginning, and I remember running down 3 flights of stairs, and there was a woman there and would give me fresh breast milk and run back up. I mean, it worked like a charm. And I think we need to kind of go back to that thinking. That's the way we did it. We were in the cave. I mean, women were relentless and men were clueless, right? We were dumb enough to go out and, after making a crudely made weapon, a group of us, probably half drunk, right, and kill a 4,000 or 5,000 pound mammoth. Women are relentless because they have to micromanage the survival of the young, and that means teamwork. Women are great at teamwork.
Do you think that if a woman can't breastfeed, then is breast milk in a bottle? Is the breast milk in a bottle like? Well, the second best option would be to find other lactating women, but some people are going to think that that's not great. So is breast milk in a bottle? I mean, I guess we get the nutrition of breast milk, but you pasteurize breast milk, and we are missing that, what we're saying, this mechanical development.
Right. Well, that's my point. I would like to see women get together, working women that are home and raising families, and I would like to see them get together and have centers that are easy to get to, where if you have to do something, you can have your child breastfed properly, instead of that compromise of taking pumped breast milk and putting it into a bottle and having that so-called orthodontic nipple, mess up the facial development of your child. Yes.
Man,
That's a bit extreme.
Well, I would totally do it, and I think it takes a village. Like we are meant to raise children in community, because it takes a community to survive. So that's really interesting, and I'm glad that you mentioned it, because it's something that a lot of people might not have thought about before. So now I want to steer us into this. Okay, we know it's ideal to breathe through the nose. We know that because, for many reasons, like we have improper facial development, and a lot of us are mouth breathers from the get-go, from birth. When we notice a problem with breathing, with sleep, with facial development before age 10, there are like a different set of approaches that we can take to remedy those problems versus after age 10. Is that correct? Because we've, like, post age 10, we've kind of like set in stone some of the ways that we're developed. So I guess maybe we start there, like what to do before age 10 if you see that your child is a mouth breather, or how do you remedy that issue before, so that as an adult you have a easier time?
Right. No, that's a really good question. And I think a lot of parents that have older children and realizing that, they're not breathing properly and will have some regret, and there is hope, and there are newer techniques coming out and surgeries, and we can talk about all that. And I'm glad to say that dentistry is leading the forefront on that. But before age 10, there's a lot you can do. And as I said before, as we've talked about, the face is very malleable, and that's why it's very important to be very, very attentive to all these things that can either mess up facial development or aid in proper facial development. But after age 10, maybe to age 11, 12, it depends on a lot of things, hormonal growth, even your environs, and diet. But when this is set in stone, so to speak, then there are things we can do. For example, in the old days, we used to do what was called orthognathic surgery. That's where they literally do this little buzzsaw cut, sagittal cut of either the upper or lower jaw or both, and they would move everything forward. But that very often did not fix the real problem, that is the width of the face, the width of the jaw. So now there's a lot of talk about these DNA appliances and things that you can pop in the mouth. This is after age 10, okay? Rapid maxillary expansion before age 10 is doable. It's a removable or fixed appliance that you put into the kid's mouth, and the parent will turn a little wheel, and that expansion can happen in 6 months' time, even sooner.
So is that expanding the roof of your mouth?
Yes. Yes. It's making the maxilla wider. And while the child's growing, it's promoting forward growth, width, and everything's filling in. And the teeth are not suffering as a result of that. But afterwards, if you are fully developed, how do you do that? Let's say you're an adult and you have a narrow tapering face, you've got sleep apnea. You've retrognathic. I mean, I'm describing myself in some aspects here. There is a way to make that jaw wider, and it is kind of a surgical method. And this is the newest and latest. This may sound kind of not gross, but a little extreme, but it's not. You can actually, dentists are placing implants into the palate. They're called SDIs, small diameter implants. We can put implants anywhere in the mouth. It's amazing. Mm-hmm. And it may even perforate into the sinus, these things, temporarily. These implants get placed into the palate, and then the appliance that we've been using in other areas gets bolted onto these implants. And because it's bolted onto the implants, it's pushing in a different way. It's pushing the jaw wide. A lot of these devices in adults are pushing the teeth out, and that's not the same thing. That's not promoting the proper jaw development. That's not affecting the box and back, the airway box, the nose box. And sometimes you can push the teeth right out of the jawbone. Those are called fenestrations. That can be that can lead to gum recession. And so there is a method now, and the good news is that we can digitally, after a 3D bone scan and space scan, cone beam technology, after that all that information gets input into a program, there are algorithms now that will predict what the face will look like if you exert certain forces. I mean, we can predict the outcome now. And so it's much safer, it's gotten easier, and this can be done, and I'm not exaggerating, this can be done in 6 months' time on an adult. And they can go to work and function. And so there are methods coming, and it's because of this the ability to scan everything digitally and to preview what's going to happen. So it's pretty cool. This is all cutting edge. In fact, I'm in a study club that is talking about this, and so it's not in the dental curriculum yet, but the technology is there, the techniques are there, and also the studies are coming. I mean, things are looking good. It's expensive, yes. Does insurance cover it? Maybe. It depends. I mean, dental insurance, medical insurance will sometimes cover orthognathic surgery. That's where they just cut the jaws and slide things forward, but that causes nerve damage, doesn't widen the face. So after the fact, I don't want to not have people not have any hope. Before I knew of all this, there really wasn't any hope. You would have to wear a CPAP or an oral appliance and fix the symptoms and not treat the root cause. Now we have a way with these implants and pushing off of the implants and with the digital algorithms that predict what's going to happen. We have ways of basically taking your face after it's having developed and fixing that development.
Okay, that's really wild. And it does seem extreme. It does seem like, oh man, we should just fix the problem, before it happens. But
right.
But we're talking about post age 10 faces development, how to change that. Is what you're speaking about is like a layperson's term for it, a palate widener? Because I've met people in the Weston A. Price community who tell me that they have palate wideners. Is that what? Okay.
Well, it's more than that. So that was the thing I was referring to that didn't really work well in adults. And that was the one that pushed the teeth out past the bone. It is a palatal widener, but where it's being connected and what it's pushing off of is different. And it's all because of those implants the fulcrum has changed because of those implants. And those implants are removed, by the way. You throw them in, you have the device, you deliver the device, you teach them how to widen it, or they come in and we widen it. You get a CAT scan to monitor the progress. And in other words, we can't see a lot of this past the tissue. This bone scan allows us to see what's going on. We can measure it. We can quantify we know what proper facial development is, and we can quantify that we've reached that. And we're not just looking at the teeth, we're looking at the airway box. We can actually see airways widen. Let me put it that way in simple terms. We have a before and after 3-dimensional x-ray, And after we've made the adjustments via the implants and this palatal expander, we can actually, in a resting position, this is not asleep, we can see that the airway has enlarged.
Wow, that's unbelievable. So widening, but without moving the chin forward.
Well, the chin forward is tough. That is tough to do, although sometimes that will go with the widening of the upper. And there are things you can do on the bottom. That is, it's not ideal. It's best to do this before age 10. But
right.
I have to say, this is a pretty impressive method, and it's better, I think, in most cases, better than the orthognathic surgery. Orthognathic surgery had a recovery time of 6 to 8 weeks, and even then it would take a full year. This method is quick and easy, and it sounds terrible, but you know, to do this start to finish, I mean, clinically, these are short surgeries, and not much trauma.
What is the name? What is the name of this surgery, or the name you said?
It doesn't really have a name. I mean, it's just a technique now it's rapid maxillary expansion, but it's how you do it that counts. You know, what are you pushing off of? Now, there is a surgery where they cut the midline, the palate, they cut that open, and then they hope it fills in after you widen the palate. It doesn't always fill in. That's painful. There you're creating some trauma, some bone trauma, some bleeding, some potential for infection.
Okay. That, like, all of that is wild, and I don't know what to think about it. I mean, you know, I'm thinking that there are so many people who maybe don't have access to that. And so, like,
True.
Another way to remedy, let's talk about like other ways to remedy breathing, which means to remedy sleep, to make sure you're getting into deep enough sleep, which affects every area of your life. You mentioned, and in your book, you talk about CPAP machines, APAP machines, and you talk about MAD devices. Can we talk about those things and how they affect sleep? I understand that, like, those are Band-Aids, you know, to some degree. They're fixing, they're not fixing root cause, or they're not changing facial structure, but rather they're just allowing you to be properly oxygenated so that you sleep well.
Right, exactly. So in simple terms, let's say you get a diagnosis for sleep apnea. Your airway doesn't have the space or room that when it relaxes, it can't stay open. It collapses. So what do? Well, since I think the 60s, we had this machine that would blow air into your system. It would blow like a balloon. It would keep the airway pressurized so that it couldn't collapse. Mm-hmm. And that has a host of issues. Of course, you're wearing a mask, and it can rub on your face. It can dry out your airway. It can predispose you to pneumonia, perhaps. It's difficult. It's expensive. You have to carry it around. A lot of people don't like the stigma of having to wear this mask. You can also wear an oral appliance, which is what I wear. I used to have 12 interruptions per hour. Now I have 0. This is all based on sleep studies. My jaw gets held in place in a forward position. If my jaw falls back at night, which everyone has the same issue because our muscles are relaxed, the only muscles that work in deep sleep, hopefully you are in deep sleep, are your diaphragm muscle for breathing, for basic breathing, your heart muscle, of course, your eye muscles for REM sleep, for rapid eye movement. There is a muscle in the ear that is still has tone. We're not sure why, but all the other muscles relax. They become paralyzed and they lose their tone. So these airway muscles, especially as we get older, will fall, you know, and if you're breathing through your mouth a lot, that airway is very dry. When they do stick together, they're more likely to stick together. That's why nose breathing is so important. Another reason for it. But anyway, so what do? Well, we blow air past that and create enough positive pressure inside that closed system so that this can't happen. It's not very elegant, is it? I mean, it's a machine that's blowing you up all night long. The oral appliance is great because it just pulls your tongue forward, or your jaw and tongue forward. That actually creates a lateral expansion of the airway and doesn't work on everyone. And that's not necessarily the go-to remedy. CPAP I recommend to all my patients, if the insurance pays for it, or even if they don't, get the CPAP, get an APAP, and get used to that if you can. It's very difficult to learn how to use, but it's always a great backup. It's great to have. And then if you have mild to moderate sleep apnea, then an oral appliance may be effective for you. And those are simpler. You just pop them in. I pop it in my mouth at night and I go to sleep. I mouth tape, I put something over my eyes to make the room dark, and I'm good. That literally takes me less than 10, 15 seconds.
Okay, so then the question is, how do I know if I have a sleep problem? Most people wake up feeling tired. I would say most people wake up feeling tired with some aches and pains, and they need coffee and a good hour to get going.
Right.
That is not normal, even though it's become the new normal.
Right.
So you talk about in your book the importance of measuring, because I cannot, even though I'm exhausted when I wake up, I still can't. I don't know exactly what's happening when I sleep. So how do we measure?
Right. So that's a really good question, and that is part of the big issue. So let me tell you what I'm a very observant, very scientific person. I'm always measuring. That's just the way I am. I've always been that way. So before I knew anything about sleep and my sleep and my ability to sleep, which was not good, I could tell you the difference between a good night and bad night of sleep, right? Mm-hmm. There were some nights where it was terrible. I would toss and turn, and then I would wake up and I would be grumpy and tired. It would take me a while to get out of bed, and I didn't feel well for the rest of the day. Maybe I got sick the following day. And then there were some nights that I slept a little bit better, but I was still tired. So that delta between a good and bad night was almost the same. When I treated my sleep apnea and had no interruptions and was in deep sleep, deeper stages of sleep longer, and I had REM sleep, and I didn't toss and turn, then now I know the difference. Now, because my baseline has changed, and because I now know what a good night's sleep is and what a bad night's sleep is, mm-hmm. because I fixed it, or because for the first few nights maybe I didn't wear my device, then I would wear it. Plus I was testing with external devices because I was looking and helping develop tests for this at home. I mean, I'm now much better at determining how I slept. And that knowledge compared to what I was before, even though I have a scientific background, it's ridiculous. You cannot verify or make an assumption about your own sleep if you don't have that basis or that background or that context. It's context. So that's the thing. I always tell, and that's what I said in my book, you cannot verify your own sleep. You cannot make any assessment of it. Maybe your sleep partner can, if they're tossing and turning and kicking and snoring. That is a more accurate assessment from the person you're sleeping with. But for anyone that tells me, oh, I sleep fine, I right away discount that. And that was me. I would tell people I slept well. I was a light sleeper. I was very proud of that because I could hear my daughters come in late, or I could hear the dog getting up and, wondering if there was a threat outside. But that's not good sleep. And also I was very proud of being able to go to sleep quickly. That's sleep latency. It should take you 10, 15 minutes to get to sleep. When you wake up in the morning, within 30 seconds of opening your eyes, you should be getting out of bed and feeling good and stretching, or feeling that need, like you're bored, you can't sleep anymore. I thought, before that, it was like, oh, let me just get another 15 minutes. I was sleeping past the alarm. That's not normal. You cannot assess your sleep. You need to get tested. Or maybe you have a spouse or a partner, sleep partner, or loved one. Maybe we can train dogs to tell us that we're not sleeping well. I mean, they do so many other things so well. So yes, it is the new norm, and I'm so concerned to hear people, oh, this is how I slept last night. Last night was a good night. Last night was a bad night. Don't go there. I went there and it was a mistake. I had no idea. Let the professionals get in there. Maybe wear a wearable, that's a place to start. Maybe have your iPhone on at night, listening to you while you're snoring. I mean, I'm not going to tell you that those are perfect, but I am looking for something where, and they're coming, these devices are coming, where everyone can test their sleep every single night. Hopefully we don't get too obsessive about it, but where we can get good, accurate data on how much REM we got, how much deep sleep we got, and whether this is a good day or bad day ahead of us.
Well, I have so many thoughts. I think a lot of people are really defensive about their sleep. I tried to talk to my dad about it because I realized, as a diabetic older man who wakes up a couple of times a night to use the bathroom and has a thicker neck and gout and all these things, there is no way he does not have a sleep disorder, but he's like, I slept fine. I'm sleeping better. I don't snore anymore.
Right.
And I just had another conversation with the neighbor about it, and he's like, I sleep fine, and so it is interesting. I do think that people don't understand like the repercussions of not sleeping well are so grave. Not just quality of life, but also shorter lifespan. Mm-hmm. And I think about like the number of books and the number of people now that are suffering with anxiety and depression, especially like younger, fitter, thinner women like myself. I have that profile. People that think that it's some sort of personality defect that they have, that they, that they are have the personality that they have, but it's, if you don't properly enter into deep sleep at night, your brain cannot detoxify yourself, it cannot repair itself, and you literally not fulfill your potential as a human being. So it really makes sense that, like, ideally getting a sleep study, which you discuss in your book, a PSG, is going to be great. I think that, and I'm thinking too about my audience, there are probably a lot of people that don't have easy access to that. So if your partner tells you that you snore sometimes, and if you roll around, you have twisted bed sheets, which means you're moving too much, if you, wake up exhausted, can you skip the professional sleep study and we just said you can't self-diagnose. See, that's the issue. I just feel like the problem is that you discussed this, is like lack of accessibility to professionals who can really not only help diagnose the issue, but also walk you through this kind of long process of healing.
Right. And that's the purpose of the book. The book has been, people love the book for the fact that in 4 or 5 hours, with the long checklists and a very organized way of presenting this data, they can get to the solution very, very quickly. And so here's the thing: I hear people fixing their sleep all the time, and what you were talking about with your dad reminded me of this. Is they would say, well, okay, so I snored a little bit. My wife told me I snored. Well, I got some blackout curtains. I got a different pillow, a better mattress, and now I don't snore, and I fixed my sleep issue. That's something we cannot do. That's something that you need to leave to the professionals. You need to know what sleep is. So complicated, and we understood so little of it, and we still do to a certain point. I mean, I can go on and on about what a good night's sleep is and tell people what it is, but the problem is they'll go home and try and fix that. For example, getting up in the middle of the night to go to the bathroom, that's probably a comorbidity of sleep apnea. You know, I mean, and that can be fixed, but it's best to measure it. You need to leave it to the professionals. You need to get a PSG, and you really need to know at what part of the night are you getting deep sleep, the first part of the night, and then later in the early morning, are you getting more REM? When does your resting heart rate drop? Is it early in the night? Is it late in the morning? I mean, in the night of sleep. And you know, there's so many parameters that we can look at. There is one device that I like. It is a little pricey. It's a $300 ring. It's literally this little ring that's called the Oura Ring. You've heard about it. It's probably about 60% accurate when it comes to sleep stages, but it gives you a lot of other data, and it does give you a good idea of what is going on in the middle of the night. But I would not recommend that ring to anyone unless they've had a sleep study. I've had like 10 different sleep studies, probably more. That's just official studies. Then there are all the testing devices kind of studies and all that. And so I know my sleep very well, and I compare it to the Oura Ring, and it is a useful device. Are there other trackers out there that are useful? There's some that are terrible, and then I have a lot of patients, you know, telling me, you know, look at my watch here, it tells me I'm sleeping great, and I know they're not. I mean, they're drinking coffee in between conversations, and they're tired, and this is at 2 o'clock in the afternoon, and they, you know, they can't get out of bed, and they're overweight, and they're making bad food choices, and they're not happy, and their blood pressure is elevated, and there's so many ways to see sleep, poor sleep. When I go to cocktail parties, and I drive my wife nuts, of course, I mean, I pretty much know within seconds of having spoken to someone, sometimes minutes, who's got sleep apnea and who doesn't. And I go around in my day identifying that, and you know, it's not always pleasant for people, and men are more difficult than women, of course. Women listen and think, maybe I do have sleep apnea. Men are like, no, that's not me. It's the guy over there, but it's not me. You know, large neck size, high blood pressure, going to the bathroom a lot in the middle of the night. They're getting sick a lot. And you can't, I think I wish I had treated my sleep apnea earlier. I didn't know, of course. But you know, when you're 80 years old and you're near the end of life, maybe at 90, maybe at 100, whatever, you're going to wonder, how much smarter would I have been? How much happier would I have been? Would I have done things differently? Would I be thinner, healthier? Would I be in less pain? Would my organ systems be healthier if I had treated it? And the answer is yes. Unequivocally yes. So I tell people, don't be that person when you're 85 and suffering because you didn't make decisions now that will help you.
Yeah, I think that we're designed to be happy and healthy, and if we're not, then we say, well, why aren't we? And I do think that everybody is really looking for the answers in our waking hours,
right,
without regard for what's happening in our sleeping hours.
Right.
There are no, how do I say this? Like, there are no herbs, there are no supplements, there is no amount of nutrient-dense liver and grass-fed beef that can save you from a bad night's sleep. It's just, it cannot, like, the stress on your organism cannot be, like, maybe it can be helped a little bit by those things, but
you're fixing it after the fact. You know, methylation, oxidative stress, and all that. You're fixing it after the fact with nutritional help and exercise and maybe medication and all that, but you're not treating the root cause if you're not fixing your sleep.
Right. Okay. I want to discuss briefly mouth taping because this is something that you've spoken about. Well, you've mentioned earlier in the interview and that you've spoken about in depth in your book and then in other resources that you have. Like I talked about mouth taping a few weeks ago on one of my Facebook posts and people were like, what? You know, this is unbelievable.
Right.
What are you doing?
I know. I know. That's pretty wide tape. Who makes that tape? Is it 3M?
Micropore 3M. Yeah, it's really wide. That might scare people.
Yeah. Do you tape?
Well,
have you tried taping?
I have, and honestly, like, I feel like I'm going to suffocate because I've always, even now in this interview, like, I'm always gasping for breath, even during the day. I mean, I have been a mouth breather my whole life and not known it.
I mean, there are a lot of tests out there, a lot of, there's been so much that's been written about it. For example, if you can do mild exercise and talk at the same time, that's a good sign because you're breathing through your nose. So yeah, that's exactly how I tape. I use 3M NextCare. It's a little stickier, a little bit more comfortable. A lot of people can't do this, and it's not dangerous. No one's going to die or suffocate. But I use it as a differential diagnostic. In other words, if people can tape and the tape is on all night long and they wake up with it, then I know that they have the potential to nose breathe. Maybe their mouth falls open anyway, and then I would say continue to mouth tape. If the tape's always coming off, you need to see an ENT. You need to fix that. And the root cause is that you don't have the structures inside your nose that allows you to be able to breathe through your nose. So a lot of borderline cases of pre-sleep apnea can be fixed by this. If your child is breathing through their mouth, I would encourage you to keep trying to mouth tape, and sometimes you can force the issue. It depends on your nasal patency. Is it partial? Is it full? I mean, are you fully blocked? I mean, you would know that within a few minutes. If you can keep the mouth tape on for a few hours, maybe by trying and continuing that and bringing down your breathing rate, of course, that helps, then maybe you'll reach a tipping point where you can mouth tape all night long. So mouth taping is very controversial. If you talk to an ENT, they will tell you that's the worst thing you can do. I don't understand why that would be, although there are some surgeons now that are recommending it, and it's a great tool. It's a great device. I tape every night. Most of my patients tape. Most of them, I would say 95% of them, are amazed at what it does for them almost immediately, usually the next morning. Now, if it keeps coming off, then that's great. That tells me time to refer to an ENT. I have an ENT nearby me. He's all set to do a modified Mueller's maneuver and to be able to tell me what's the problem. Usually we get a sleep study at that point. And so this is concrete data. This tells us a lot. Wouldn't you want to know whether you could breathe through your nose or not? This is the easiest way to do it. It's easier than going to see an ENT. An ENT can tell you, but this is testing it.
Right. So if people are uncomfortable at first with taping at night, that's a really good idea. Like, oh, I'm working on the computer for 2 hours, so let me tape my mouth and see how I feel about that. Like,
it's hard. It may be harder to do while you're awake because your breathing rate is higher. But remember, tape, a lot of people think they need to tape it shut so it can't be forced open. The tape is a reminder. It is a reminder just to keep your lips closed. Your jaw is still opening and closing. You can vertically tape. There's also a nice product out there called Somnifix. It's a very nice looking lip-shaped tape with a vent in it. But people know whether they can do this or not instinctually. When I recommend mouth taping, they're like, oh, that's not me. Forget it. Or they look at you like they're shocked. Those people know that they are mouth breathing. But then we talk about it and see if we can do it. We experiment in the chair and that read about it on the web. There's lots of great information. And there are probably 25 good reasons you should be breathing through your nose. There's some crazy reasons out there. For example, if you have if you have a lot of space in your nasal passages, and I think I see this. I mean, the hypothalamus can see light, and that could affect your circadian rhythms. If you can't breathe through your nose and it's very blocked, that's not going to happen. Humidifying the nose. We talked about the rate of air coming in and out was important. The nitric oxide. Nitric oxide is great for vasodilation. It's also great for oxygen uptake. It helps oxygen uptake. Everybody wants more oxygen to their muscles and to their brain. They also want to be happier. I mean, there are so many proper development for children. Nose breathing is important. I ask everyone, every time I see a new patient, I ask them, please, let's talk about the ability to nose breathe. That is like that's a pillar of health. And if you can't breathe through your nose, I have solutions for you. We can fix it. Maybe it's learning how to mouth tape. Maybe it's pushing that envelope a little bit. A lot of people can't even mouth tape at night because their heart's racing. Their breathing rate is so high. You got to bring that down. Then put the tape on. See how long it stays on. Anyway, it's a fascinating area. We talked about it in the book. There's been a lot more discussion about it since I wrote the book.
Right. Well, I like the idea of mouth taping because it's something that's accessible to everybody. And my concern is that people don't have dentists and don't have ENTs that are trained in this, because I think about myself. I had so many now to me very obvious signs that my entire life I have mouth breathed, which has been one of the issues why I'm not properly sleeping at night. And I've never had a dentist or a doctor tell me that I was not breathing right. So I guess it's very disheartening sometimes to realize how alone you might be in this journey towards better health and to find these root cause issues. And so I like the idea of mouth taping because it is accessible, but my concern is that if it's a diagnostic tool and I can't mouth tape properly, then
what?
Yeah, then what? If I don't have a team of people, how do I help myself? I think that a lot of people are going to be in that predicament, because I even made a post, about all this, and several people in the comments said, my little girl mouth breathes and she tells me she can't close her mouth and I don't know what to do. I think people just don't, when things aren't well,
Right.
There's this sense of I have no idea what to do and I feel alone in this path.
Right. That is a real problem, even in the area where I practice. It's hard to find like-minded people, and they're there. And even as a practitioner, it took me a long time to find them, to be able to refer to them. And that will change. But for now, I feel very bad for the people that really only have the internet for that kind of information, for that guidance. That is a sad thing. But, on the other hand, how nice is it to be able to be told, try mouth taping. If it keeps coming off, you know that you can't breathe through your nose. That's wonderful information. That's information you would never have gotten by just going in to see your primary care physician. They're not looking at you going like I am with my patients. One of the first things I talk to them, even if I don't notice that there's a problem, how are you at nose breathing? And they're like, what? I mean, really? And in dentistry, there's the whole dental aspect of it. Breathing through your mouth increases your chance of gum disease, decay, cavities. I mean, because your mouth is dry. How do you upset a biome? Well, drugs, pH change, medications, diet, and one of the great factors in pH is a dry mouth, and it's so easy to happen. It's so easy to occur. it happens almost immediately. Keep your mouth open for 45 minutes. I guarantee you'll see a big drop in pH. Keep it open all night long, and the biome changes dramatically. The oral microbiome.
Yeah, it's true. It's truly wild how we've totally not paid attention to probably the most important function, which is breathing.
Right.
I do want to just mention diet briefly because we mentioned hey, you know what? Maybe the prevention of a lot of these issues, at least to some degree, is proper preconception nutrition. So mom and dad are healthy before they even conceive, and then mom is well nourished in pregnancy. Mom is well nourished when she's giving you breast milk, and then you as an adult can nourish yourself, limit food allergies, have as low level of the congestion as possible to promote optimal breathing. So is there an optimal human diet for support of proper breath and support of proper sleep?
Well, there probably is. I mean, the answer is yes, but it's a complicated answer. Let me just get one thing in that relates to this, because I always forget to mention it. Preconception nutrition. One thing that I always am very concerned about is sperm motility and the quality of the sperm in someone who is not sleeping well. I mean, so dads that are trying to get, to the couples that are trying to get pregnant, make sure you're both sleeping well, especially the husband, because there's a lot that can go wrong there in terms of DNA and motility and infertility and et cetera. But then, of course, it's also about diet. The big one that I find just really disheartening is in Western medicine, we always fall back on, hey, by the way, we can eliminate, for example, midline defects if you just take all these vitamins. I'm talking about, the B9 folic acid, right? But that turns out to be the wrong form. That's in our diet. If you eat the right diet, you'll be fine. But it turns out a lot of women have been taking the synthetic version they've been taking folic acid, which is the synthetic version of folate, right? And then there's some genes that prevent you from converting it to folate. But if we just been eating the right diet and not so focused on these wonderful magic pills like these vitamins, prenatal vitamins, we would be fine. So we're seeing a lot of tongue ties now because it turns out we've been taking the wrong form of this B vitamin that prevents spina bifida and all that. And because of that, all we had to do was eat the right diet. Of course, this is a Western price diet. It's a paleo diet. It's a carnivore diet. I mean, I hate getting into diet because the whole vegan carnivore thing gets stirred up, and that's very sad that we're having those conversations and dealing with that. And of course, that's a personal decision. But remember, what you eat before you conceive, after you've conceived, the perinatal phase and the postnatal phase, those are all so important. And the big ones are, and Western Price has been given credit for that missing link or that factor X, and a lot of people say it's K2, but D is important, D3 is important, especially if you're not getting a lot of sunlight exposure. A is important, and then eating a lot of calcium is important, so that comes from our diet, of course. But once the calcium gets in your body, what helps it get across the gut barrier? Well, D3. Then it's in the bloodstream. Well, what helps it get to all the calcified tissues? Well, you need to have K2 on board, right? And maybe both versions of K2, MK4 and K7. One's fat soluble, one's water soluble. I mean, it's very complicated, and we try and take this over with nutrition and magic pills when it's always been
Okay, Dr. B, we lost connection for a little bit, but we were talking about how people have become to rely on pills and, you know, kind of these synthetic versions of these vitamins, but without focusing on a nutrient-dense diet. And humans are omnivores. I mean, period. We need nutrient-dense animal products to thrive.
Right. Yep, we do. So it really upsets me because we always think we have a better way of doing things, and then we mess it up. And that whole folate, folic acid is a perfect example. I mean, it's probably why we're getting more tongue ties. There's some people that say it could be why we're seeing a rise in autism. I mean, I'm not saying I agree with that, but we really have to focus on diet, and we have to make sure we have a good, clean diet, free of chemicals. And then what about mercury and metal fillings? I mean, what does that do to conception and preconception issues and all that? I mean, there's so many toxins in our world. Fluoride in the water is a big mistake in terms of calcification and growth of calcified structures. Glyphosate is probably a inhibitor in terms of growth of jaw bones and even any calcified tissue. And it's everywhere. I mean, you can't hide from it on this planet. So yeah, I think we really need to know what the master plan is. The master plan is already in place. We know what it is. We just have to look back to our ancestors. And that's what Weston Price did. His observation of that, and I'm proud to say that he was a dentist, was brilliant. I mean, he didn't get it all right, but he got a lot of it right, well before anyone else did. So that's wonderful. And I think we need to think a little bit more like he did. I mean, what are the people that are developing correctly? What are they doing right? A lot of it is diet, just eating the right foods. You don't have to take vitamins, and how do we know we get the vitamins right? How do we know they're stored properly? How do we know that they don't take on too much moisture, or they're exposed to heat in the warehouse before they're shipped to you? These are all factors that influence the bioavailability and the efficacy of a supplement. And obviously the way we make it, synthetic, not synthetic, can a mother convert folic acid to folate? I mean, we need to know all this stuff before we start throwing out these things, these advisements on what to take before birth.
Do you guide your patients through diet, or do you just focus more on diagnosis of sleep disorder, remedy of sleep disorder, proper breathing, and then kind of allow the diet to shift?
Oh, no. Diet's related to caries, gum disease, overall health. I mean, my first visit with a new patient is 1 hour long, and typically it'll run over or go to another half-hour visit. And I mean, for some reason, patients expect to be able to spend more time with the dentist, which is wonderful. I'm all for that. But with the physician, it's quick. It's over with in 12, 15 minutes, which is unfortunate. And typically what they're doing is they're medicating, and they're looking at one specific thing. And maybe it's a physical, but my physicals take maybe a half hour at the most. And that's a physical. That's the whole body. So I'm giving a lot of nutritional advice. Yes.
Okay. Do you have any like top 3 nutritional advice that you give to people?
Right.
Or any,
right. Well, the top one is to eat an optimal diet. I mean, what better nutritional advice can you give? But then, we have a lot of vegetarians in our area, and it becomes difficult there. And then you have to talk about the diet that's best for that person. What's their ethnic background? Where did they grow up? How do the genes play with their environment and with their diet? That's a little bit out of my realm, but I have a referral for that. We have a lot of very unhealthy very thin South Asian males. That's a very specific, very homogeneous, kind of very vertical body type, physiology type, and that's impacted greatly by the Western diet. They have sleep disorders. They get gum disease very quickly, very readily, and heart disease. There's a specialist in our area that works just with South Asian males. I mean, it is overwhelming. I don't think patients understand how difficult it is for someone to get the big picture. And that's why I like functional medicine. I also refer a lot of my patients to a functional MD or a functional practitioner, because I know they're not getting the right advice, or they're not getting any solutions from their conventional Western medical doctor. So yeah, I'm kind of doing all that. It's kind of hard to bill for that, but it you know, that patient is with you for life, and I'm hoping that they don't have any dental needs. If you give them the right advice beforehand, in terms of gut microbiome, they're going to have fewer cavities. There are connections. They're going to be a better patient. They're going to come in more often and get their cleanings done. They're going to eat better. It's the whole picture. You always have to look at the whole picture. Dentists, of course, are looking at teeth. Physicians, you know, specialists are looking at whatever part they're good at treating and what they've been trained in. And there has to be more collaboration.
Where can people go to find a good dentist? Is there a website? Like dentist?
Yeah, I wish there was. It depends on the area. I think really it's you have to search on the web. And what I tell patients, and we have a blog post on this, on how to find a good functionally minded dentist, someone that can predict whether you're going to have sleep apnea, and you know, maybe you're taking the wrong form of B6, B9, B12. You know, that's burning mouth, burning tongue. I mean, they're all, again, as you said at the beginning of the show, what happens in the mouth, it's not a window to what is happening. It is what is happening. In other words, exactly. It is. I mean, it can be a reflection, of course, and it's, so you can tell a lot from the mouth. And of course, the mouth contributes to overall inflammation. I have a lot of physicians that are treating based on CRP levels, and they completely ignored the contribution from gum disease or even gingivitis to CRP. In fact, I have a 2-page form that I give to the patient to take to their physician that allows them to see how much of that CRP is determined by what the patient's going through in terms of oral health, like gum disease. And a lot of cardiologists call me and go, oh my God, this is brilliant, because I've been trying to get this patient's CRP down and I can't do it. I didn't realize that they had full-on gum disease. Well, of course, gum disease is related to heart health. And so again, a practitioner, and it's not easy. I'm not telling you it's easy. I'm not saying it's easy. Any practitioner, whether it's a functional health practitioner that came out through being a acupuncturist. I mean, all of us have to look at the big picture, including the patients.
Mm-hmm.
It's important.
Yeah, it is really important, and it's, you know, that's the beauty of the internet. Even though, you know, it creates a lot of like disadvantages and lots of noise, we do have access to more and more information. And even people that are watching this interview and that don't speak English, you know, Google Translate does a very, very good job.
Good.
So copying and pasting articles from askthedentist.com is a good place to start. You know, there's a lot of good information. You all, your team, your daughter, and yourself have made this information accessible and also understandable to the general public, which is really important.
Thank you.
So just to wrap up, I want to, because we've talked about so many things today, I guess I want to reiterate the fact that, like, A dentist does so much more than just fill a cavity. Like a dentist, like you said, sees your mouth, and what happens in your mouth is what's happening in the rest of your body. A dentist can see whether or not you're breathing properly. We know that by design, we should be breathing through the nose and not through the mouth. Breathing through the mouth creates a variety of issues, including lack of ability to sleep properly, to get into deep sleep. And without deep sleep, we simply cannot function optimally as human beings.
Correct.
So that's kind of a wrap up. And then, I just want to reiterate, what are the action steps? Because I do feel like people will see this and be like, oh my gosh,
what do I do? Right.
Yeah. What do I do?
Well, that's a great question. What I would, maybe one thing you could do, I think it's important, even if you're a healthcare provider, we have this oral microbiome reset program. It's a 28-day program. Okay. If you sign up for that, and we talked about this earlier, if we get enough signups, we will translate it into Spanish. We will have it translated. I think that's a great place to start, because if you don't see the big picture properly, every little road you go down in terms of treatment paths and diagnostic paths will be wrong, right? I mean, they will lead you to the wrong modality of treatment, and that can be problematic. Then you start talking about side effects or no results at all. So I think I always tell dentists, we need to become practitioners of the oral microbiome. That's what a dentist needs to do. We need to start there. That is the fundamental pillar of how we need to see the mouth. It is a extension, not an extension, it is part of the gut. It is the headway, or the headwaters to the gut. The bacteria in the mouth and the bacteria in the gut are shared. There's a 50% overlap. And remember, we're swallowing 140 million bugs a day in the saliva that we swallow. Mm-hmm. And the bugs here determine what the bugs are doing here. We know how important the gut microbiome is, of course. So that's how we need to be seeing things. I'm seeing things now differently. I wish I had seen this back when I was a young dentist 34 years ago. This is how all dentists and patients, I include patients, we need to see the mouth as this very complex, beautiful kind of environment, kind of like an organism, a superorganism that does so much for us. But if we mistreat it, like with the wrong mouthwashes, the wrong toothpaste, the wrong chemicals, mouth breathing, whatever, overbrushing, underbrushing, poor diet, then that goes south, and other things go south in the body. So again, I would start off with a program like that. In those 28 days, I guarantee you will see the mouth in a completely different way. And it will motivate you to do things that maybe you didn't know about before. Mm-hmm. So maybe that's a great place to start. And that's even, I'm even saying that to practitioners. A lot of people that I know and know well and respect and can't believe what they're saying in terms of how brilliant it is. And then I start talking about, gingivitis and how it can lead to Alzheimer's. They just draw a blank stare, and that's sad. And that's the fault of medicine and dentistry. We diverged, we bifurcated in the late 1800s. It's a long story. You don't want to hear it. It's ridiculous, though. It is absolutely ridiculous.
Okay, so yeah, I think that program, there's no doubt in my mind that we can generate enough interest to be able to translate that program, that oral microbiome program, into Spanish, because I think it's really important. And I think that, I just think that this information about the mouth and about the mouth in relationship to sleep is just, it's true. It's so significant for health. It's so significant for well-being, and it's so significant for so that someone can really and truly like live their full potential, which is to be happy and healthy and probably like a glass half full kind of person, even when the world doesn't seem like such a great place,
Right.
you know? So I will definitely be sharing information about that program. We already mentioned the website, askthedentist.com. It's also on you're also on Instagram as askthedentist.com. And I really appreciate your time. I'm just so grateful for your work. I think it's really important.
Thank you, Katie. I appreciate it. It's great being on the show.
Thank you. I will talk to you soon.